So here at Devon Air Ambulance we have 2 helicopters and 2 Volvo XC90s. This is one of them just behind me here. As you can see, they're fully marked and they have the blue lights up on top of the vehicle for us to respond under emergency driving conditions. Our service has developed drastically in recent years. We are now delivering enhanced and critical care to the roadside, so in many cases we are able to do exactly the same interventions as what would be done in the hospital setting. So we carry 2 bags, 1 blue PAX bag and 1 red PAX bag. As you can see here, we've got lots of different sized blood pressure cuffs. The Tempus monitoring allows us to measure patients' heart rates, their blood pressure, their oxygen levels, their breathing rhythms. Within our top pouch we have some oxygen masks and some nebulizers, and we have a sealed airways bag to make sure that we know it's fully kitted. So these are our selection of eye gels, which are used to manage a patient's airway. All of our endotracheal tubes, and we have lots of basic airway adjuncts as well. Within the red PAX bag, we have lots of things to manage major trauma and hemorrhage. So we've got blankets and heated blankets to help keep our patients nice and warm and prevent them bleeding. In the current COVID climate, we have some of our white Tyvek suits and an infection control pouch. We have an intraosseous pouch, so this is a bone drill which enables us to deliver medication to people if we're unable to get a little needle into their arm for whatever reason. We've got a pelvic binder, so this comes around a patient if they've broken their pelvis in a specific way, which helps to realign it and prevent any blood loss within the pelvic cavity. We've got a blizzard blanket which helps to keep patients warm. It's like a giant foil blanket. So this is our ventilator. This is what we use to breathe for our patients that aren't breathing. It's exactly the same as one that you would find in an intensive care department in a hospital. This is our large suction unit, so if patients have a lot of vomit or a lot of blood or secretions in their airway, we will use this to suction that out before we're able to pop a tube in or an eye gel in that you saw earlier to manage their airway. This is the Lucas, so it's a device that we use to deliver chest compressions to a patient in cardiac arrest. And tucked in at the back of the car we have the green bag, which is the bag that we will use when we're first on scene, so it's our first response bag. And the blue bag is a splints bag, so if people have broken any limbs, we can wrap them up and we then suck the air out to hold their limb nice and steady. So in the back of the car we have our Tyvek suits, just some spares, in case we see lots of patients one after the other and don't have time to restock. We also have some pairs of gloves and our face visors, and these green helmets that you can see tucked on the back of the seats are for use if we attend, for example, a road traffic collision. So in the front of our car, as well as all the normal things that you would find in a car, we have a little iPad which we use to navigate to our incidents, and when we input the route it shows us exactly where we need to go, a bit like a sat-nav system. And this is the panel that we use to put on the blue lights, so 999 mode, it all lights up. And so we often get asked what's the best method to get to scene, whether that's by car or whether that's by helicopter. Both have advantages, both have disadvantages. So our cars are particularly useful when a job is close to the airbase, or if we are attending a patient in the city centre. The aircraft are particularly useful if we're going to a job in a rural location or somewhere that's difficult to access.